Hey everybody, thanks for coming to my presentation. I'm presenting on my practicum placement with the Global Goal Local Impact Project, Access to Abortion Services for Indigenous Women and Two-Spirit Peoples in Canada at the University of Victoria. So my name is Arie Ross. My pronouns are she and her, and I'm a grateful and uninvited guest on the traditional territory of the Lekwungen, Songhees, WSÁNEĆ, and Esquimalt peoples in Victoria. I am cisgender, straight, and a white woman, and proud dog mom to Eclipse and partner to Kieran. I'm a fourth generation settler of Central and Eastern European Jewish descent. I have much unearned privilege as a white, generally able bodied person, which has benefited me in almost all facets of my life. I'd also like to express some gratitude. So to my supervisor, Dr. Renee Monchelin, who has really warmly welcomed me into this work and has supported me so much through this term and beyond. I am really humbled and so grateful to be a part of this. And I want to also acknowledge our research team, who have also been super welcoming and made me feel like a part of the team since day one, as well as to express gratitude for the Indigenous Advisory Committee that's guiding the project, as well as to Dr. Jeff Masuda for guiding me through my practicum and thesis journey, and then all of the support from my wonderful colleagues in the Masters of Public Health program. So for my practicum, I was a research assistant with the Global Goal Local Impact project. And one reason among many that I chose to do this was that I was encouraged to find a research intensive practicum as I am writing a thesis, and this will help me to gain skills that I really need to write that thesis. So a little bit about the background on the importance of this topic. Indigenous women and Two-Spirit people experience sexualized violence at a rate 3 times higher than non-Indigenous people. And they also face increased barriers to accessing abortion services, and this is due to ongoing colonialism and disparities in social determinants of health and health outcomes. However, there is no existing literature available regarding the specific experiences of Indigenous peoples with abortion in Canada. And so this project actually is the first of its kind in the country. The project aims to advance knowledge around Indigenous experiences accessing abortion services in Canada, and it consisted of 15 one-to-one interviews with Indigenous people with abortion access experience from across the country in this pilot project. And ultimately, this research is aiming to bridge the access gap and improve access to culturally safe and appropriate abortion services. And within the project, my focus was on analyzing themes of stigma within the interview transcripts, which is going to inform a component of my thesis research. So within the transcripts, experiences of stigma were widespread, complex, and layered within the experiences. Every participant spoke to themes of stigma, whether that was external, so that includes social and community stigma, internal, including anticipated judgment, secrecy, and shame, as well as service provider stigma, or a combination of all of these. Attempting to categorize and separate these concepts was difficult as they all sort of described like intersecting aspects of stigma that were all clearly linked with the abortion experience. And it's just important to note that the existing literature on abortion stigma does not specify service provider stigma as its own category within stigma. But within these interviews, it was actually the most commonly noted source of stigma. So it felt important to take note of that within this research. So 10 participants described experiencing service provider stigma, sharing that they felt judged or pressured by service providers regarding their abortion, and services felt cold, hostile, and dehumanizing. So one participant shared that the doctor told me that I was pregnant, and I immediately was like, well, I want an abortion. How do I do that? And he was an old white-haired old man. And I was just trying to explain, I've literally never wanted to be pregnant in my life. I'm only 18 and that's not what I want. And he literally said, I don't want you to feel like you're making the biggest mistake of your life. So this participant described how shame and stigma from the doctor caused them to question their decision and contributed to secrecy and fear about sharing their abortion with loved ones. This is another quote surrounding stigma. So when I was in the foster care system, I remember just constantly being told, you're going to end up pregnant at 16, or you're going to end up a single mom or whatever, just because those were the labels that were put on young Indigenous folks who are pregnant. So I believed that, so I was really ashamed with this pregnancy. So you might notice from this quote that this speaks to several aspects of stigma, including anticipated judgment, internalized and external stigma from community, as well as social stigma surrounding harmful stereotypes around experiences of being young, Indigenous, and pregnant. These stigmas contributed to personal feelings of shame and to this participant deciding not to share their abortion as well. So this internalized shame often stemmed from community beliefs and was common among individuals who grew up with a Christian or Catholic religious background or influence in their community. And 6 participants noted that residential schools and religion had negatively influenced community views around abortion. So with that in mind, how can we improve access to abortion services in Canada? What follows are solutions that were identified by participants around how to improve abortion access. So this is adapted from an infographic I've been working on, distilling these key recommendations. And this is what we can do to improve abortion access in Canada right now. So first of all, access. We need to provide widely available, accurate, and accessible abortion information and resources in order to close the access gap and reduce confusion for folks looking to have an abortion. As well, we need to recognize that abortion is non-binary. And we also need to normalize talking about abortion. The literature indicates that open conversations around abortion can help to reduce stigma. And another thing that we need to do is just to recognize that abortion is simply a medically necessary health service and it should be treated as such. This is part 2 of the infographic adapted to slides. So the third recommendation is to destigmatize. So we need to provide thorough support services available immediately and for several months following an abortion. And we also need to amend clinic and hospital policy to allow a support person to be present throughout the abortion, as is the case during a birth or an IUD insertion. And we also need to make space for the reclamation of traditional knowledges. Several participants acknowledged that traditionally in Indigenous communities, they believed in, quote, honoring pregnant people's self-determination of their own bodies, end quote. That's a quote from one of the participants. So we really need to make space for the reclamation and resurgence of traditional reproductive practices and knowledges, as well as to shift away from the colonial mindset that abortion is a wrong thing to do. We also need to recognize that Indigenous reproductive knowledges and medicines are effective. They existed before contact, and they continue to exist to this day. So just to summarize a few of my key learnings, I've honestly learned so much during this practicum. It's been an amazing experience. But one of the key things for me is just like learning how to be a better collaborator as a white settler working in the Indigenous-led research space. And as well, just to approach the work with humility and gratitude, as well as the importance of co-development of knowledge translation products within community and participatory-led research. This was my first step into qualitative research led by community, and I really wanted to sort of emphasize the importance of involving community at every step of the way in a research project. Within this particular project, all community partners have been invited to participate in the research in whatever way they would like to, and that includes co-authorship and co-development of knowledge translation products and manuscripts. And finally, I just want to say and highlight the importance of honoring community voices, autonomy, and self-determination, and the importance of remembering who the research is meant to serve and to center those voices in all of our decision-making. And yeah, that's it for me from this presentation. Thanks, everybody. Looking forward to hearing questions.